So this was a case that they sent to me and I didn't know what was going on. And what the history was, he was diagnosed with ADHD. He tried Ritalin, it made him aggressive. Then he saw some other doctors and they thought he had Asperger's. And they gave him a medicine called Risperdal, which is a medicine they often give for Asperger's and autism. And it made him sedated and he couldn't function. And then when they brought him in, I realized he hadn't had a good evaluation. And when we tested him, we did find ADD patterns and Asperger patterns, but we found this pattern that looked like a seizure disorder. We confirmed it with a neurologist that he had a seizure disorder. He saw the neurologist. They were able to go ahead and get the seizure activity normalized, and now he started to do neurofeedback because the parents actually didn't want him on this medication because he had side effects from that. But that's what I'm going to be talking about, is how this test, the QEEG, can lead to an accurate diagnosis, because sometimes it is difficult. Even on the surface, so it looks simple. And then how we have different treatment options, particularly the neurofeedback, which is a computerized, non-drug approach that can have lasting side effects and long-term effects without any side effects. And we're going to be talking about that today too. So let me get kind of at the beginning a little show of hands. How many of you are here for a child that you think or you know has attention deficit disorder? Okay. And how many of you are here for a child that you think you know has autism or Asperger's? And some of you could raise your hands both, because we know that students can have ADD and Asperger's or autism. And how about adults? Any of you here for an adult that may have ADD or autism or Asperger's? I'm glad a lot of you are raising your hands, because it is genetic. So if you are here for one of your children, by the way, keep open that it's genetic. And if your child has it, there's about a 50% chance one of the parents has it. And every talk I've given over the last 25 years, someone's come to me later and says, you know, I came there for my child, but I sat there and realized that I think I have this, or I had it as a child. So we'll talk about that later. My name is Dr. Michael Linden. I'm the Director of Attention Learning Centers. We have offices in Irvine, San Juan Capistrano, and Encinitas, and I've been in the field for 27 years and have really seen this whole field and this technology develop very, very well to where we can really do these accurate tests now. I'm a child clinical psychologist, a marriage family therapist, nationally certified in biofeedback and neurofeedback for 25 years. I was very fortunate. I got involved in this field in college, and just when people were starting to do this, when we started to do the neurofeedback in California, there were 3 people in the country. Now there's thousands. When we started to develop this QEEG test for ADD, it was just starting, and now it's getting more accepted. We've done a lot of research with ADD. We did one of the first controlled studies in the country on neurofeedback. Recently, we've been also doing a lot of work with autism and Asperger's. We've developed different subtypes and discovered those different types of ADD and autism and Asperger's, and we have a new article that's coming out this month about all the research in neurofeedback and QEEG with autism and Asperger's. So that's what I'm going to be talking about today. How I go through the talk, by the way, is I'll kind of go through different areas. First, I'll go over the background and what ADD and autism and Asperger's are, some of the symptoms, and we'll talk about the tests, and then we'll talk about the treatments. And some of you may be wondering, why would I put this in the same seminar? Isn't ADD very different from autism? It is. But it ends up that many of the treatments, especially for older students with autism and Asperger's, were kind of developed from the ADD field. And in families, we see a lot of families that have autism have parents or relatives with ADD and vice versa. So it tends to have a lot of things in common, even though they're very different, and autism is often more severe. Now, the other thing a lot of people ask me is, how did you get involved with this? How did you start doing this 27 years ago? I didn't know this when I was in college studying this, but I ended up having the ADD in my family, starting with my uncle, who's a physician, very bright man, chief of staff at a hospital on the East Coast, has terrible ADHD, but just like a lot of emergency room physicians I see, he multitasks. He's very good at doing numerous things at once. When I visit with him, I have to walk around. He can't sit still and talk just to have a conversation with him. And it ended up my cousins, my 2 male cousins, his children, both had ADHD. And he tried all these medications, was never able to find the right medication for them. He actually sent them to private colleges on the East Coast for students with ADD and learning disabilities. One of them actually was expelled from the ADHD college, which is kind of hard to do. I don't but it was really frustrating. It was really frustrating. And then when I was actually in college and starting graduate school, I started to see these symptoms in my younger brother and sister. Both of them were diagnosed with dyslexia, but both of them had different types of ADD that were totally missed. My brother, who's very bright and has a MBA, was diagnosed with dyslexia, had the inattentive type of ADD, and I actually was the one who kind of brought it up and helped him get assessed. And he's very bright, but he has a hard time holding down a job. He's very unorganized, can't do paperwork and taxes and things like that. And then my youngest sibling, my sister, actually has ADHD. Usually the boys have more of the ADHD hyperactive type and the girls have the inattentive, but in my family it was the opposite. And she got through school and college because she was an athlete. She was a very good athlete, got a scholarship to college based on sports, is actually a professional athlete at this point. But when she is injured or she can't play sports and she has to sit still and work a regular job, she really gets impatient, is unorganized. When I was just back there visiting her about a month ago, and every time we were going to get together, she was like 2 hours late. But she's actually just got recently tested too. So I kind of saw this, and I saw so many people were misdiagnosed, and that's really what got me interested in this. So the main points I'm going to go over today, and I'm going to use a lot of abbreviations. ADD stands for all the different types of attention deficit disorder, and ASD, autistic spectrum disorder, is going to consider autism, Asperger's, pervasive developmental disorder. These are biological genetic disorders. We know this now. We didn't know this 10 or 20 years ago. That the QEEG mapping, the test that I started to show you in the video, and other computerized testing can lead to accurate diagnosis. And the more accurate your diagnosis, the more accurate your treatment plan. We're going to talk about subtypes of ADD and autistic spectrum disorder, medication, and how a multimodality approach, and how we're doing this is using neurofeedback kind of as the foundation, because it can be a successful long-term treatment without side effects. And that's really what I think the goal is a long-term effect without side effects, because we know that most of these disorders, most of these are kind of lifelong. You may improve, but most people don't outgrow these. So some of these slides are old. This goes back to when I started doing these talks 20 years ago, and some of these are in that welcome packet that was on the table. So this is an old slide that talks about the problems associated with ADD and ADHD. By the way, this is a father who's praying for help because he has 8 children and they all have ADD, autism, or Asperger's. A couple cases I've seen this has been accurate. And this is a mom looking for the 8 kids because she can't find 2 of them, and she's trying to get them to go somewhere. This can be very difficult because it is genetic, but usually in ADD, where people think of the hyperactive kids, the kids that can't sit still. They're disruptive in class. But a lot of times it's just the attention. They have a short attention span. They're distractible. They get restless. They can't sit still. They have social problems. This is why social skills are so important. The kids with ADD are impulsive. They're forgetful. They are bossy. They're kind of act before they think. They cut in line in front of the other kids. They say things before they think about it. There's cognitive problems. They have problems in speech. They test low on IQ tests, but when they're treated, their IQs go up 10, sometimes 20 points because they can pay attention better. Learning disabilities are very common with students with ADD. About 40% have those, but most don't. And a lot of times the schools will test, and if there's no learning disability, they'll tell parents there's no problem. More often there's ADD that they're not testing for. Now the other thing that can make this complicated is there's emotional problems that go with all of these, especially depression and anxiety. For example, for children, about 1 out of 4 that have one of these disorders have depression or anxiety. With adults, 85% of adults with ADD have anxiety or depression with it. And often that gets diagnosed first and the ADD gets missed. So that tends to be really important. Even things like allergies, ear infections, sleep problems, physical things are more common with ADD. What about adults? I have just one slide on adults, but we see a lot of adults. You know who our biggest referral source for adults with ADD is? It's other therapists, psychologists, social workers. They're doing